How to perform a surgical skin prep, including an overview of asepsis and keywords used in the lesson. Keywords. Asepsis is the practice of keeping an area or objects free from all microorganisms, non-pathogenic and pathogenic, including spores and viruses. This is also known as sterile technique. A nosocomial infection is an infection acquired after the patient has entered the hospital setting. Insurance does not pay for these. A timeout is a mandatory pause just before the skin incision, verifying the patient is correct patient site and procedure. The surgical prep occurs prior to the timeout. The surgical skin prep is a non-invasive procedure, therefore there is no timeout required. The skin is prepped after the positioning of the patient and placement of additional arterial and accessory lines. Some of these lines or procedures require their own timeout, as they are considered invasive. Therefore, there may be more than one timeout for any given surgery. Proper skin preparation is one of the most important steps in preventing nosocomial infections. Steps involved in prepping the patient's skin. Clip and remove all body hair from the entire surgical area. Aseptically open the desired method for the prep. Aseptically don a sterile set of surgical gloves. For an abdominal prep, begin at the incision site with a sponge and lightly scrub your way around the center in concentric circles, being careful not to miss any areas until the solution has come in contact with the patient's skin from table to table and nipples to knees. Clipping the patient's body hair. Body hair is resistant to standard surgical prep procedures due to its structure, so it must be removed prior to surgery. Clipping is the preferred method of hair removal because it has less trauma than the traditional razor, which causes micro skin cuts to the patient's skin. Donning sterile gloves. The clean hand picks up the opposite glove by the cuff. The glove is pulled onto the corresponding hand just beyond the wrist. Using the now gloved sterile hand to pick up the remaining glove, inserting the fingers into the cuff and pulling the other glove onto the ungloved hand. Aseptically pull the remainder of the cuff over the wrist of each hand and adjust the proper finger positioning. The two main types of prep solutions are DuraPrep or ChloroPrep and betadine scrub and paint. Warning: DuraPrep and ChloroPrep are flammable. Common abdominal surgical sites include midline, left upper quadrant, left lower quadrant, right lower quadrant, right upper quadrant, and phalansteal.